Hi everybody, and welcome to another episode with the Anxious Resistance. Today I'm going to be talking about something a little bit different. This is a medication side effect that is common with a lot of mental health medications. I'm going to jump into it, and it's called Priapism. This one is not for kids, and this one, most of it won't apply to the female audience here. But priapism is a prolonged and unwanted erection of the penis that occurs without sexual stimulation. It causes penile pain, rigid penile shaft, and erection that lasts for more than 4 hours without sexual stimulation. Priapism is a rare but important side effect of some psychiatric medications, especially antipsychotics, which may evolve into a urological emergency if not treated promptly. Priapism can lead to tissue damage, erectile dysfunction, and psychological distress. So this is something that's very important for you to know about. If you're a male, if you're taking antipsychotics, this can also occur with some antidepressants. So if this happens to you, you need to seek treatment immediately. So let's get into what types of priapism there are. There are two main types, ischemic and non-ischemic. Ischemic priapism, also called low-flow priapism, is the result of blood not being able to leave the penis due to impaired venous outflow or smooth muscle contraction. Ischemic priapism is the more common and more serious type of priapism, as it deprives the penile tissue of oxygen and nutrients. Ischemic priapism requires immediate medical attention to prevent complications. What is non-ischemic priapism, the other kind? It's also known as high-flow priapism, and this occurs when blood flow through the arteries of the penis is not regulated properly due to trauma or abnormal communication between arteries and veins. Non-ischemic priapism is less common and less severe than ischemic priapism, as the penile tissue still receives some blood flow and oxygen. Non-ischemic priapism may resolve spontaneously or require conservative treatment. Now, what are the causes of priapism? I've mentioned some. One category of causes for priapism is blood disorders. Conditions that affect the shape or function of red blood cells, such as sickle cell disease, thalassemia, leukemia, or multiple myeloma, can cause ischemic priapism by obstructing the blood flow in the penis. Now, this is the big one for us because we talk about mental health on this channel, is medications. Various medications can cause priapism by affecting the neurotransmitter systems or enzymes involved in the penile erection. Medications that have been reported to cause priapism include antidepressants such as bupropion or Wellbutrin, trazodone or Deseril, fluoxetine or Prozac, just to name a few. Antipsychotics such as clozapine or risperidone, just to name a few, and anticoagulants such as warfarin, which that one's not as applicable to mental health, but many of you may be taking blood thinners. And alpha blockers such as prazosin. This one is specific to mental health too, because prazosin is often prescribed to treat nightmares. We also have clonidine, which is in that same class. It's prescribed to treat anxiety. So you may see those with mental health conditions too. Now, another cause is trauma. So if you have an injury to the penis or pelvis, or even the spinal cord, where the nerves are going through to the penis, you may have some issues. You can also have issues with priapism from metabolic disorders, conditions that affect the metabolism of substances in the body, such as gout or amyloidosis, can cause ischemic priapism by depositing crystals or proteins in the penile tissue. And another one, this one is important with mental health. Drugs of abuse can cause priapism. These are substances that alter the brain chemistry or blood pressure, such as cocaine. Alcohol can cause priapism by stimulating or inhibiting the receptors involved in penile erection. Okay, so how is priapism diagnosed and treated? The diagnosis of priapism is based on the medical history and physical examination of the patient. The doctor will ask about the duration, frequency, severity, and triggers of the erections, as well as any underlying conditions or medications that may be related to priapism. The doctor will also examine the penis to check for pain, rigidity, and swelling. Some tests that may be performed to confirm the diagnosis and determine the type of priapism include blood tests, to check for blood disorders or infections that may cause ischemic priapism. Another one is blood gas measurement to measure the amount of oxygen and carbon dioxide in the blood in the penis and compare it with the blood in other parts of the body. A low oxygen level and a high carbon dioxide level indicate ischemic priapism. Again, Doppler ultrasound can be used to assess the blood flow in the arteries and veins of the penis. A reduced or absent blood flow indicates ischemic priapism, while a high or normal blood flow indicates non-ischemic priapism. Toxicology screening is also done to detect any drugs of abuse that may have caused the priapism. Okay, so how is it treated? The treatment of priapism depends on the type and severity. The main goals of the treatment are to relieve pain, restore normal blood flow, preserve erectile function, and prevent reoccurrence of the priapism. Some treatment options for ischemic priapism include aspiration. This is a procedure that involves inserting a needle into the penis and draining the blood from the erectile tissue. This may be repeated several times until the erection subsides. The blood may be replaced with saline or medication that constricts the blood vessels, such as phenylephrine. Another treatment is shunting, a surgical procedure that involves creating a bypass between the erectile tissue and the veins or glands of the penis. This allows the blood to flow out of the penis and reduce the pressure in the erectile tissue. Some oral or intravenous medications that may help reduce ischemic priapism include terbutaline, etiliphone, pseudoephedrine, or ketamine. Some treatment options for non-ischemic priapism include observation. Some cases of non-ischemic priapism may resolve on their own without any intervention. The patient may be advised to avoid sexual stimulation, apply ice packs, or take painkillers. Another treatment for non-ischemic would be embolization, a minimally invasive surgical procedure that involves injecting the substance into the artery that supplies blood to the penis. This blocks the abnormal communication between the artery and the vein and reduces the blood flow to the penis. Again, surgery can occur, and a rare option involves repairing or ligating the artery that is damaged or leaking blood to the penis. Okay, so how do you prevent priapism? Some measures that may help prevent priapism include treating the underlying condition, managing any medical condition that may cause priapism, such as sickle cell disease, diabetes, hypertension. Can also reduce the risk of priapism if you maintain and treat these conditions well. And again, if you have these conditions plus you're taking psych medications that may lead to it, you may have an increased risk of having priapism. So the next thing, which is kind of an obvious one, you avoid medications that may cause priapism. If your medication causes you priapism, your doctor may want to switch you to a different one because it may happen again. And you don't want to risk having complications such as permanent erectile dysfunction, becoming impotent, not being able to have sexual intercourse, that kind of thing. Another thing that you should do, and this should be obvious, avoid those drugs of abuse. Refrain from using substances that may alter the brain chemistry or blood pressure, such as cocaine or alcohol, as mentioned before. Okay, so what are some complications that may arise from priapism? Number one, and I've already mentioned it, erectile dysfunction. Prolonged or recurrent episodes of priapism can cause damage to the penile tissue and impair its ability to get or maintain an erection. This can affect the sexual function and quality of life of the patient. Infection. Any invasive procedure that involves inserting a needle or a device into the penis can introduce bacteria and cause infection. This can lead to inflammation, pain, fever, or sepsis. Another complicating factor could be psychological distress. Priapism can cause embarrassment, anxiety, depression, or low self-esteem in some patients. This can affect their mental health and social relationships. Okay, to conclude, priapism is a rare but serious side effect that some of the psychiatric medications, especially antipsychotics, can cause. It is a prolonged and unwanted erection of the penis that causes pain and tissue damage. Priapism can be classified into ischemic and non-ischemic types, depending on the blood flow in the penis. The diagnosis of priapism is based on medical history, physical examination, and some tests. The treatment of priapism depends on the type and severity of the condition and may involve aspiration, shunting, embolization, medication, or surgery. Priapism can be prevented by treating the underlying conditions, avoiding medications that may cause priapism, and avoiding drugs of abuse. Priapism can lead to complications such as permanent erectile dysfunction, infection, or psychological distress. Thank you so much for watching this video. I hope you learned something. Priapism is serious, and can have some major complications. If you want to see the sources for this video, this article, check the full article linked below on our website. If you have any questions, please comment them. This is a serious issue. You did get to hear me say penis a lot of times, but please be aware of this and watch for it. And thank you so much for watching this video with the Anxious Resistance. If you enjoyed it, please like it and subscribe for more content just like this. Thanks so much for watching.